Okay, I think it's time to actually tell you guys why I stopped being a nurse practitioner. I know I say this is one reason, this is one reason. Let me tell you the damper, the nail that took me out.
Doctors and nurses are quitting all across America. As you know, their job can be very, very difficult. Long hours dealing with different personalities of people they don't know from a can of paint. So I get it. If anybody has worked in customer service, then you know exactly what I'm talking about. But nevertheless, these doctors has had it up to here. They're done. They're out of there. They don't care about the student debt. They are checking out. Check out these videos and see for yourself.
Okay, I think it's time to actually tell you guys why I stopped being a nurse practitioner. I know I say this is one reason, this is one reason. Let me tell you the damper, the nail that took me out. Okay, so you know how dentists tell you or commercials, tell you 9 out of 10 dentists recommend this toothpaste, right? That's what they'll say. And you actually have to think about that, okay? Because if 9 out of 10 dentists are recommending this toothpaste and they make their money off fixing bad teeth, would they really recommend you good toothpaste, or would they recommend you something to keep the money coming in? Okay, with that being said, how do I say this without saying this? I don't get blood drawn anymore. Blood draws and bloods being drawn are one of the most expensive things that insurance makes money off of right and left, right? Because you're not going to get a physical or anything done without, hey, let's get some blood drawn, right? So if you're not feeling good, let's just say you own a lab, okay? Or better yet, let's say you own a gym. What would be the best way to have repeat people for gym, right? It would be to go to your scale and make your scale 5 pounds higher so that everybody who thinks oh, I gained some weight, I need to come in here more, right? So when you own a lab, the way to make more money would be to have your lab skewed, right? Oh my gosh, your cholesterol was off the charts. Oh, this must be a mistake at the lab. Let's get your blood redrawn. Well, your insurance doesn't pay for lab errors or incorrect lab draws or whatever, right? But you're going to go get it redrawn for your peace of mind to make sure your cholesterol has come down, right? Let's just say I'm really good friends with somebody in the industry with the lab. Need I say more? They make more money when you need labs drawn again. So here I am trying to fix people, and their labs keep coming back weird, right? But then some of them, when I go to a different lab, are normal. The healthcare industry, the rabbit hole is so deep, y'all don't even know. So when they told you guys, stock up on gold, stock up on silver, stock up on everything, stock up on food, learn how to grow your own food, and learn how to handle your own healthcare, there was a reason for it, because a lot of shit is coming to light. And there's a lot of reasons there's a nurse shortage, because nurses are seeing shit that y'all don't want to see and you're not ready for. That's all I have to say.
Yes! I did it! I finally quit my nursing job! Oh! I quit my job! Yes!
We are cooked. We are cooked. Because I do not know a single doctor or nurse who is willingly going to sign up to go work in the hospital for another pandemic. We cannot have another pandemic because we, as the people who are on the front lines, we are traumatized. We are burnt out. Let me give you one example of how healthcare workers were treated during the first pandemic, and hopefully the only pandemic during our lifetime. We were only allowed to have one. We were each given one mask, and you were required to wear it until, and I quote, it was visibly soiled, which means if it didn't look yellow, brown, and it didn't have blood on it, you were gonna wear that thing out. 1 week, 2 weeks, and you had to present it to whoever was in charge. There were guards. There were people guarding the cabinets that were holding the masks. They were guarding our PPE. We couldn't just go and put one on. We were required to show and present our dirty mask. When you pass the check of visibly soiled, then you got a new one. That's like wearing the same dirty underwear because we are exhaling our own natural waste, okay? We are absorbing the ambient virus and spit and aerosolized particles all over our face, okay? We were required to wear the same mask for days. Now, that's just one example. Imagine everything else. So if there is another pandemic,
I finally made up my mind to leave military medicine after my service commitment was over for a civilian primary care job. After all, I had recruiters texting and emailing me all the time. I knew there was a shortage of us everywhere. Thankfully, my doctor friend invited me into this private Facebook group for physicians that had nearly 30,000 doctors in it at the time. Every day, there was another primary care physician on there begging for advice on how to stay afloat the workload of primary care. They were dealing with the same exact moral injury and burnout that I was. There was never enough time for good medical care. Their corporate employers were constantly double and triple booking them. Their patients hated it and wrote negative reviews all over the internet, when the root cause was really the broken insurance-based system that did not reimburse primary care well, so it incentivized volume over quality. Every now and then, I would see in the comment section of these doctor forum posts a suggestion that the distressed primary care physician should consider switching to direct primary care. I was intrigued. I had briefly heard mention of direct primary care once in residency, but I assumed it was something that catered to wealthy patients. However, the more I learned, the more that was not the truth. I realized that this could actually be the future of primary care and a big step in fixing our broken healthcare system, since DPC patients often save money on healthcare overall by having a direct relationship with a highly trained physician who actually has time to take great care of them. And these doctors actually like their jobs, so more doctors will want to do primary care. I started listening to a DPC podcast every day on my drive to and from work. It kept me going and gave me the reassurance I did not need to quit being a doctor altogether to maintain my sanity and my integrity. I just needed to leave the insurance-based healthcare system, which included military medicine.
So I quit my nursing job. Oh wow, that feels so weird to say. My name is Megan. I've been a nurse for 8 years. And before that, I was a medical assistant for 4 years. So all in all, I've been in healthcare for 12 years. My last day is coming up soon, and it just feels super weird to be leaving a job and not going to another one. So much of my identity is in nursing, and what it took me to get my nursing degree was like the hardest thing I had ever gone through, but that's a story for another day. And yeah, it just feels like I'm kind of giving up a big portion of my life. And I'm giving it up so I can be with my kids and focus on my family for what feels like the first time ever. Work has always been a priority for me. I've worked a lot of hours, did a lot of traveling, a lot of driving, and I'm just ready to be at home with them. And I'm super grateful and super thankful that we are financially in a position to do this. Only negative thing is we're going to lose my health insurance, which sucks. And honestly, I mean, to work in healthcare and work in a hospital, my health insurance is just trash. It's absolute trash. So we're just going to get insurance through the marketplace, and it'll be trash too, but I mean, no different than the trash I had. And I'll go back eventually. Like, this isn't permanent. This is temporary, like while my kids are in this current stage of life. And I'm still going to keep my nursing license up. Nothing is going to change as far as that. So I'm just kind of super excited to be a stay-at-home mom. What the fuck? That sounds so weird.
I quit. Just like that. So today is day one of going into work after putting in my 2-week notice. I know it's probably going to be awkward as fuck. I really don't care. I'm so over the toxic work environment. The unit coordinator has an attitude. The girl that does our schedule has a horrible attitude. The patient care techs have a horrible attitude. Actually, it's 3 of them that I really like. They're pretty awesome. But there's one in particular that's just the bad bunch of the apple. And The nurses have attitude. It's like such a mean girl, mean boy culture. And I hate it. And I cannot wait to just get out of there. It's nothing like having a healthy work environment. And this is just not it. There's no team effort. There's no anything. Like, I can't wait. Quit, baby. I can't. I don't want to be somewhere that I hate being. I have panic attacks every time before I go to work. And I'm just over it. I don't care. I don't get paid enough. Like, I just don't. Like, I do not encourage. After my 2 weeks is up, I will tell you guys what hospital I work at, and I'll let you know why I do not encourage people to work at that hospital. Like, the culture is very horrible. We don't even have sick time. I don't know if this is like a norm in hospital culture, but we don't have sick time. I think that's stupid. Why? I work in an emergency room. We work with the sickest of the sick people. They be coughing in your face, all kind of shit. Why don't we have sick time? That is fucking weird. And I'm over the weird shit. So I quit. Y'all hopefully won't hear me complain about work no more. I plan on going back to flying and doing nursing per diem because I just want to have fun. I just want to have fun and make money. That's it. And eventually transition into tech and real estate and be somebody fucking housewife somewhere sitting on a beach with a fucking pina colada or something. Get in lipo so I don't got to work out. That's it.
What's up, everyone? It has been about a year since I've posted a video, and there's a reason for that. It has been a busy year. It's been a very busy year. Here we go. I'm leaving my job. I'm not just leaving my job, I'm actually leaving my career. And for the last year, I've been trying to put together a deal to make this work to where I can leave my career. For the last decade, I've been a pulmonary and critical care nurse practitioner. And now I'm not going to be. So that's going to be weird. So while I won't have the interesting, gory content that you find in the hospital, I should have some decently average content here and there. So stay tuned for the details of how I put this together and what is going on. But we'll see you soon.
I want to know how all the doctors and nurses are doing, knowing that a pandemic is coming soon. Like, how are you doing? I genuinely want to know because half of you are probably going to boycott, so we're all fucked.
Gang, I'm tired of working in Boo-Booville. Gang, I am tired of working in Boo-Booville. Gang, if you don't know, I am literally a CV ICU nurse, bro. I'm literally on the job now. I'm getting blood for one of my coworkers, bro, just because I'm kind of chilling right now. And, bro, my patient has explosive diarrhea so bad that I want to literally quit. Gang, I want to quit, bro. One thing they don't tell you about the ICU is that your patients, it is encouraged for them to have the most massive, nastiest, stinkiest boo-boos of all time. It's encouraged, bro. Especially in the CV ICU, bro, because they're fresh out of surgery, and we want to make sure their bowels are working, bro. I go in there, I'm chilling. One of my coworkers, she like, Teddy, let's clean patient. I said, why? They had massive poo-poo. Man, come on, don't tell me that, bro. Gang, don't tell me that, bro. I go in there, bro, it's the craziest thing I ever seen, bro. Man, these patients' poops be so stinky, bro. When I actually go home and do what I got to do, I don't even got to spray because it ain't even that bad. I go in there, and I get right up and just walk out. Bro, get me out of Boo-Booville, gang. Get me out of Boo-Booville, bro. Let me know what other unit has to deal with boo-boo like we do, bro. And this is why we need 6 figures, gang. I ain't trying to hear that, bro. And I shouldn't have to travel to get 6 figures, bro. I'm in Boo-Booville, gang. Let me know if I'm tweaking, bro. Do we deserve 6 figures off of that alone, or am I tweaking? Man, I be nursing, gang. God, dog, I be nursing.
I messed up. I need to quit my job now because I was in a room full of doctors, okay? All wonderful people, great doctors, amazing. And they were doing icebreakers, right? I'm the new girl in town. I'm like the youngest attending right now in my division, but that's besides the point. Anyways, so they're doing this icebreaker, and of course they just go with the, what animal would you be if you could choose to be an animal? Okay. So everyone went around and said their thing. I want to be a horse. I want to be a lion, blah, 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 blah. They get to me. And because I don't know what to say, and because all my answers, for some reason, have to be neurospicy flavored, guess what I said? Just guess. You're never going to guess. Because I said, Squirtle. I would want to be Squirtle. And one of the doctors is like, oh, really? And the other one's like, why? And I'm like, because I only have 2 moods. Turtle or squirrel? Turtle or squirrel? So I want to be Squirtle.
Well, there you have it. Now, these doctors are quitting. Keep in mind, we have a pandemic, an alleged pandemic that's on the way. And do you think these doctors want to deal with that after 2019? That was a highly strenuous moment for the medical professionals, for doctors, for nurses, for CNAs, for LPNs, all of the above. And now they're introducing this new thing that may put them through that all over again. They want no parts of it. Now, I'm not saying this is why they're quitting. I'm saying that you add that on top of the long hours, the lack of gratitude, rudeness from people they don't know when they're just trying to do their jobs, you reach a tipping point. Doctors, I know your job is hard. Nurses, I know your job is hard. CNAs, really hard. LPNs, really hard. All of you, much gratitude. Also, leave a comment and let's talk about it. Do you know any doctors or nurses that just abruptly quit and didn't want no parts of the medical field any longer? Let me know in the comments. Until next time, peace.